So we have those three scenarios, right? One is the hospital doesn't have the interpreting services, but they will use the, the vendors. You call the phone number and you have these professional interpreters, right? Now, the problem with professional interpreters, when I hear them talk, they really do verbatim. They really stick to what the doctor says. They are professional, which sometimes it's very hard for them to switch that language from that college level language to a third grade, fifth grade language, which is required, when we talk to our patients, that we speak at a third or fifth grade language. So professional interpreters and even translators, which is the ones that do the papers, the documents, when they interpret or when they translate, uh, I hear them talk and I'm thinking, who do you think you're talking to? In a big number of these people are not highly educated and you're using these huge words, right? Then you have Kaiser, for example. So those are people that use outside vendors. They're professional. Then you have Kaiser that has realized that problem. And what they've done is they created this qualified bilingual speaking training, right? Or testing. So they really test you if you can do a medical terminology. If you cannot do a medical terminology, it's called a qualified bilingual speaker level 1, can do, directions. Oh yeah, turn right, go left, go up the stairs to the second level. That would be a qualified bilingual speaker 1. Then you have the level 2. That's where I come in. A level 2 has more of that medical terminology. It's able to translate or interpret from that medical doctor to the patient's language. That's another one. But then some people may even say no to me, and they'd say, oh, I have my daughter or I have my son that can interpret for me. And that's where it will be very interesting to see as well, right? That's when we can see between those three even, because what we have is some research as to no interpreting services, and native and proficient speakers. Okay, let's go now to those three levels of interpreting: the professionals, the medical, and then the family members, right? What's the difference there? How much of a difference do we see there? So it will be also interesting to quantify that, as to see what the length of stay is between those three, the people that receive interpreting services professionally, medical, or family members. That would be very interesting.